G'day everyone, it's just Dr. Megs here. I'm just going to try to tape a really quick video blog for you guys about fever in children. There's a lot of parents who have approached me lately and are really worried about the cold and flu season, which is right upon us. I think, most parents are pretty worried about when their children are sick at the best of times, but in the current climate with the COVID crisis, everyone's even more worried than usual. So the purpose of this video is to go through with you the basics about fever in children, what you can do for your kids at home if they have a fever, and when you need to seek medical attention for them. In the context of COVID-19, a couple of points. In Queensland, where I am at the moment, the community transmission for now seems to be relatively well contained, but this is not a reason to become complacent. There is no real community or individual immunity to this particular virus, so the risk is still there. So we still need to make sure that we observe social distancing, that we wash our hands, cover our coughs, all of those sorts of things. There is a new COVID Safe app that allows you to be notified if you've been in proximity to someone who has tested positive for COVID-19, and I think that's probably a worthwhile venture. Essentially, however, if your child has a fever, all of the rules in assessing and managing your child apply regardless of whether we're worried about COVID specifically or not, and that includes isolating your child so that they don't make other people sick. A couple of key points. Fevers in kids are really common. Okay, most are able to be managed by simple cooling measures and paracetamol. Any child that looks ill with a fever needs to be seen by a doctor to exclude serious infections like pneumonia or urinary tract infections or meningitis. If your child is less than 2 or 3 months of age or is unimmunised, then the fever should be taken very, very seriously, and they should be seen by a doctor immediately. Middle ear infections, tonsillitis, very common causes of fever in kids, can be caused by viruses or bacteria. So they may or may not need antibiotics, and it'll be up to your doctor who is seeing you to decide on that. Most fevers are associated with non-specific viral infections and upper respiratory tract infections, okay? So when your child at home has a fever or feels hot, it's really important to know what a fever actually is, and it surprises me the number of people who don't know. We normally call normal temperature 37 degrees, but it can vary anywhere between, say, 36.5 up to, say, 37.5. We call a low-grade fever anything from 37.6 degrees Celsius to 37.9, and a fever is anything 38 degrees and above. There are a number of different ways that you can take temperature. At home, I use a thermal ear scanning device, a tympanic membrane scanning device, but all methods are effective. Some of the thermometers that you can get for under the arm or in the mouth are just as effective, and they're a bit cheaper. They just take a little bit longer to get the reading. There are so many things that can cause fever. Infection's the main one, and that infection can be in any of your body systems. So it can be respiratory, it can be bloodborne, it can be urinary tract, it can be in your ear, nose and throat. If you don't know, then that's why it's important for you to take your child to see a doctor. Fevers can be caused by rheumatological things like arthritis. They can be caused post-immunisation, and then there's this weird group of fevers that we call factitious fevers, where, for example, little Johnny's been running around in 38 degrees playing soccer for an hour, and you take his temperature after the game and it looks like he's got a fever, but actually it's just environmental. Similarly, little babies, if you overwrap them on a warm day, they can look like they've got a fever, but they just need to be unwrapped to allow some of that heat to dissipate. And one of my favourites is, little Johnny who doesn't want to go to school. So when mum gives him the oral thermometer, he sculls his hot chocolate and then puts the thermometer in straight after. And oh look, he can't go to school because he's got a fever, when actually it's really just the hot drink. Look, there are many causes of fever. That list is not at all exhaustive, but if you're worried, then you need to see your doctor. Now, what can you do at home to manage fever in your child? You can dress them in light clothes only, okay? So take off extra layers and allow heat to be lost through the skin. You can use tepid sponging, so that's when you use lukewarm water to sponge them down. Never cold water, never cold showers, and never cold baths, because rapid change in body temperature can cause febrile convulsions in susceptible children. We use some medications to control fever and pain in children. Very commonly, the most widely used one would be paracetamol. The other one would probably be children's ibuprofen. Both are very safe to use as long as you stay within the pack directions. Both obviously have certain restrictions around their use if your child has other medical conditions, but hopefully your doctor will be on top of that and will have talked to you about that. We never use aspirin in children. So, when should you be seeking medical attention for your child if they have a fever? I think before I launch into my list of things that you need to be wary of, I need to preface that with, if you are seriously worried about your child, that they're ill, then I don't know of any doctor that would be cross at you or impatient at you for presenting for medical attention. And in fact, that would be the most sensible thing to do. Most doctors, myself included, would rather see your child and reassure you that things are okay, rather than have you sit up all night with your child potentially needing treatment. Okay, so some quick points about when you should be seeking medical attention for your child. If your child has had a persistent fever for more than 2 days, if you don't know where the fever's coming from, or the fever has no focus, so your child doesn't have an overtly snotty nose or a sore throat or a sore ear. If your child is less than 2 or 3 months of age or is unimmunised and has a fever, you need to seek medical attention immediately. If there is a rash with the fever, that is non-blanching. So if you press on it, it doesn't disappear and then come back again. We call that a petechial or a purpuric rash, and that can be associated with serious infections. If your child has a high fever that is unresponsive to simple measures, so say 38.5 and above, and just unresponsive and long-standing, if the fever is associated with other symptoms such as confusion, dehydration, vomiting and diarrhea that is long-standing, and if your child has poor intake and poor output, those things are worrying. Obviously, if your child has had known contact with someone with an infection like chickenpox, meningitis, COVID, then you need to be seeking medical attention. If your child has pain that is uncontrolled by the simple measures that we mentioned before, then you need to seek medical attention. I think that's probably about it, but the safety net to all of that is that if you're really worried about your child, go and seek medical attention. So hopefully this has cleared this up for you. I'm hoping that everyone's going to have an uneventful cold and flu season this year. You can post questions. I'm going to post the link to my blog, to the YouTube video, so you can post questions in the thread underneath, and we'll see how we go, and I'll try to get to answering them. In the meantime, stay safe, wash your hands, cover your cough, and I will catch you next time.